If it wasn't for Doc Lyons and Donatelli, I'd be dead. My name's Troy Mazur. I live in Warren, Ohio, and I was a carpenter. And first I started out landscaping, and I was a carpenter.
Troy came to me as a new patient, presumably to be evaluated regarding complaints of abdominal and left groin pain. He'd had some inguinal hernia surgeries in the past that didn't go so well. When Troy walked into my office the first day, his morphine equivalent dose was 600 milligrams per day.
He started me out on Darvocet, and progressively I went from Darvocet to Percodan, Percocet, Vicodin, on all the way up to Oxycontin and Roxycontin, Clozapine. I mean, you name it, I've probably been on it. I just got out of high school. I was landscaping, and it all began by getting hurt lifting a 7-foot hemlock off the back of a dump truck. Okay. I grabbed a tree. There's a guy next to me who's supposed to be helping me, and we were pulling it, and we're supposed to set it in the wheelbarrow. And here he didn't hold his end, and I'm holding my end, and it ripped my side. Okay. So that's where I got my first hernia.
Okay.
So I went through the process of workers' comp to get it approved before I went in for the operation. Finally got it at the operation. I guess it was about the size of a quarter that ripped in my inguinal area, and I was off 10 weeks. I was stuck like this. I mean, I couldn't straighten up. For some reason, no matter how hard I tried, I couldn't straighten up. So after 10 weeks, doctor said to go back to work, so I did. And about 2 years later, another hernia. And I'm like, well, should that happen? Same location. I'm like, well, should that happen? And they say, oh yeah, they're recurrent. This is what the workers' comp's telling me. Yeah, they're recurrent, just, that way you get your operation faster. You don't have to put in all the paperwork to get a new one. Right. Well, I'm here, I'm thinking, okay. That one, I'm off 6 weeks. I'm thinking, oh, okay. And then, they give me stuff for like, whatever, 6-week pain pills for 6 weeks, Vicodin or whatever it was then. Mm-hmm. 3 years later, I get another one. And I said, oh, I'm not going back to that doctor. I said, maybe he did something wrong. I don't know why, but I shouldn't. Third one doesn't seem right to me. Right. And, like I said, they gave me medication for a certain amount of time. But here, I'm just getting worse and worse with, having been cut so many times already. 3 years after that, I got another one. And I said, I'm not going back to him. I looked into it a little bit and found Hernia Center of Ohio. He came from Canada, supposed to be the specialist for just hernias. And I go in there, and the first thing I said, I don't want another operation. I said, okay, are you going to guarantee this ain't going to happen to me again? He goes, oh, I'll guarantee you that you won't have another hernia. I said, okay. I went and had my 4th operation on that side. Goes, go back to work in 2 weeks. I'm like, 2 weeks?
2 weeks.
I say, all right, you're my doctor.
Right.
I've always done what the doctors tell me to do.
Right.
And I did that, and say another 2 years later, I got another one. So I went back to him. I said, well, I was only up 2 weeks, let's see what happens. And same thing, go back to work in 2 weeks. I did it. Here I'm doing construction,
right.
And it's not easy work.
Right.
Landscaping was actually the hardest work I ever did.
Sure.
But then, I fell into doing carpentry, which I really love, but I can't do anymore. And the whole thing is want to do something light. What is light in construction?
Right.
I mean, people say, do light work. Well, there ain't nothing light.
Right.
And I went back to work, and then like 2 months later, the 6th one came up. And I said...
All in the same spot?
Yeah. Well, it went from inguinal down to, it kept going lower and lower. Okay. So now it's down to femoral. Okay. And they actually had to wrap my femoral artery in mesh.
When I first got Troy in my care, we had done an assessment of him. He was obviously in a lot of pain at the time. He was taking an excessive amount of pain medication. He definitely needed to be in some type of pain management program, and I deal with many pain doctors. I had made the referral to Dr. Donatelli's office, and Dr. Donatelli needed him to go through a drug detox program prior to even being considered for any type of pain management. I tell a lot of patients, and Troy's a good example of this, one of my frustrations is the public perception of chiropractors. We always get lumped into chiropractic treatment. Well, what is chiropractic treatment? Chiropractic's not a treatment, it's a profession. Right. Spinal manipulation is a treatment. Right. And ironically, I treated Troy for almost a year before I started adjusting his back. And I want to say it was only in the last 6 weeks that we actually started performing traditional spinal manipulation on Troy's low back. And at that point, we're only doing it at this point because we've gotten him to the point that we could provide that type of care. When he first came to me, he definitely was not somebody who was eligible or would benefit from spinal manipulation, yet he's getting chiropractic care. Correct. And I think that's one of the biggest frustrations. And I deal with that, not only in the work comp system, but even in verifying somebody's insurance benefits. Well, there's chiropractic benefits. Well, that's spinal manipulation. Are you going to pay for my exam? That's medical. Are you going to pay for me to do a functional movement analysis on this patient and prescribe exercise therapy? That's physical therapy. So, what is a chiropractor? And I think not only the public's perception, but the industry's perception of what we do and what we're actually capable of is one of the most frustrating things I find.
If it wasn't for Doc Lyons and Donatelli, I'd be dead.
How many years were you, from when the first hernia to the point you met Dr. Lyons, how many years was that?
About 15 to 17 years.
Wow. Yeah. And you progressed from nothing to 600 morphine equivalent milligrams a day.
Yeah.
I think the keys to success here can be applied to the bigger picture, and that is very rarely does a person who has a chronic pain syndrome find a solution that comes in any one form.
Agreed. Yeah.
We throw these terms around. We talk about comprehensive care. We talk about basic conservative care. But the question is, what does that mean? In reality, if you talk to people who have found a way to successfully manage a chronic pain problem over the long term, very rarely does it involve one or two modalities. It generally involves a number of modalities, and I tell people all the time, if you can do 3 or 4 or 5 different things and you get a little bit of benefit from each one of those things, at the end of the day, that benefit adds up to a lot of benefit. So when we talk about the reasonable and appropriate use of medications, when we talk about injection therapy, when we talk about manipulation, when we talk about passive modalities, when we talk about active physical therapy modalities, and on and on and on and on, not all of those things apply to every single patient, but many of those modalities apply to a lot of different patients. And the real key is sitting down with a patient, listening to that patient, examining that patient, figuring out what the problem is, and then helping that patient be guided toward the modalities that are most likely to be helpful to him or her. Putting together the whole package so that at the end of the day, that patient, like Troy, can walk away as a success story and say, hey, look at me, look how much better I'm doing compared to where I was 6 months ago, 9 months ago, 10 years ago.
If you ask the doctor how far from where I am to where I am now, it's a night and day. Right. Like now, I can walk my dogs. I go out to the store. I wouldn't go to the store because I don't want to walk around. I was hurting too bad. At least now I know I'm gonna have pain the rest of my life. It's at a manageable level where I can go out and do things. I ain't running 5 miles or swimming or anything like that, but...
I'm not either, so we're in good shape.
At the end of the day, today, Troy is taking less than 3% of the equivalent pain medication that he was taking when he walked into my office the first day.
So it can be done if we look at
it. It absolutely can be done, and it should be done in a lot of these cases.
Too many people, especially chronic pain patients, just sit at home and they think that this is it. And this is how they're going to live out the rest of their lives. A lot of them are highly depressed, which just feeds to it. And if we could inspire somebody to find another physician, or it doesn't have to be a chiropractor, there's other physicians out there too, Maybe a chiropractic physician gives them maybe another option if they can't find somebody in their area that is willing to, accept them. Cases like Troy, though, I would stress that are going to need a doctor or somebody who's going to manage their case from many different perspectives. He's not a one-size-fits-all doctor. You have to have somebody who's willing to work within an integrated healthcare system, take a multidisciplinary approach to his case management. He's had chiropractic, physical therapy, massage therapy, pain management, you name it. So, it's all of it working together and having the right people to dictate that and manage his care that is going to be the most beneficial outcome.
Cases like Troy's are far too common. It's time for both the patient and healthcare community to think outside the box about how to deal with pain. The territorial days of healthcare are over. It's time for providers to work together to produce outcomes like Troy's. If you are a patient who has given up and have been told that this is as good as you can get, then we encourage you to find a chiropractor near you to evaluate your case and help you find the right path to relief. To find a chiropractor near you, go to www.oscachiro.org.